Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin. You have tuned into a very unique episode of Before and After, where an expecting mom shares her plans for her upcoming birth while she's pregnant and then comes back after her baby arrives to share how the experience was and what she and we may learn from it. My co-host today is Kristen Palasi. She is finishing her chiropractic studies and focusing mostly on pregnancy and pediatrics, and she's a brand new doula. Welcome back.
Thanks for having me.
Our guest today is Heather. She is in an extremely unique position with very difficult decisions to make. Heather's currently 39 weeks pregnant with her second child. Welcome to the podcast.
Thank you for having me. My name is Heather. I am 39 years old, and I recently graduated with a master's in occupational therapy, which is my second career.
What was your first career?
I was a teacher, an elementary school teacher
for
8 years.
What, a specific grade?
Kindergarten, mostly.
Oh, my goodness, the little ones.
Yeah, I like the little ones.
You can still shape them. They're like moldable clay.
She has patience of a saint.
Yeah. And then, so what sparked your switch?
Public school, too many kids in the classroom, too much policy. Mm-hmm. I liked the idea to be more creative and have a little more freedom, and that was hard to do in a large public school system.
Why occupational therapy specifically? Because
you can individualize it. You can go to so many different areas of practice, whether it's pediatrics, spinal cord injury. I met the OT at the school that I worked at who inspired me. She worked with those kids. And,
so you're still working with kids?
I plan to.
That's your goal?
Yeah.
Oh, very cool. Congrats on the second career.
Thank you.
And now a second baby. But before we get to that, you had you were expecting a baby about a year and a half ago.
Yes.
And how was that pregnancy, your first pregnancy?
The pregnancy was good. It was uneventful. And then at about the 36-week mark, I wanted to know what position the baby was in. So I asked for the ultrasound. And the position, she was head down, but some of the cord was over the cervix in front of her face. Mm-hmm. And my OB was concerned that it might get compressed during actual birth. So I went to a specialist, and he agreed that with my OB that I should be scheduled for a C-section.
Oh, you went to like a maternal fetal medicine specialist?
Yes.
For a more extensive scan?
Yes, or just to confirm my doctor's suspicion. It's called phunic presentation of the cord, 0.06% of pregnancies.
Did you also buy a lottery ticket at that point?
No, I should have on that day.
Yeah, I mean, it comes up so rarely.
Very rarely.
And,
in his 40-year career, he had never actually seen it on a scan before.
Your OB?
My OB.
Wow.
Mm-hmm.
So it's kind of amazing that he still was looking out for it, because sometimes you get conditioned to not seeing them and assume they're not going to be there.
And I don't even think he was looking. I think it just kind of, I don't know how he suddenly noticed it, but there were two chunks that it looked like it was not going to move because there wasn't much space between her face and my cervix.
Mm. Yeah, and of course, those are the kind of things that when you catch them, right, and prevent the possibility from happening of compressing that cord during childbirth, it's sort of a miracle in the sense that we have a safe way to get the baby out, an alternative safe way. What kind of birth were you planning for before that happened?
All natural. I wanted a vaginal birth with no medication. My husband and I had been taking some practice classes called the Bradley Method, where he was going to be my coach. And on that day when I went to the high-risk OB or the MFN, he said, "Can you have a C-section today?" That was a Friday.
At 36 weeks?
Mm-hmm. 36 plus like 3 days.
Okay.
Yeah. And he said, "We do not want you going into labor." And from my experience coming from all the pediatrics courses in occupational therapy, where you learn about cerebral palsy brain damage, I didn't even question it. I said, okay. Not about that day, but we were going to schedule for the following Monday or Tuesday. Mm-hmm. He didn't want me to wait to take my final exams.
Wow. So he was really concerned about it.
They were really we don't want that cord to get compressed was the thing.
First of all, let's backtrack for a second. Why did you want unmedicated natural childbirth? It's not the most common path these days?
My only friend that did it, she said, "What you tell people when they ask you that?" She said, "Because I can."
Oh, interesting.
But I just think I'm just so also very curious what it's like. Why not go for something like that? I just was always really interested in the human body as well.
Are you naturally minded in general?
Kind of.
Do you lean more holistic in just your lifestyle? Are you more active? Are you
A little. I'm not too. I do. I try to eat well. I try to do. My environmental footprint probably isn't the cleanest, but
Right.
I like the idea of what the human body can do.
are you outdoorsy?
I am a little outdoorsy. I haven't been so much
Adventure?
lately, but yeah, I would say so.
And you were still in school.
I
with
was.
the first pregnancy.
I was. Yeah, it was right around finals time.
Okay.
And so I was not present for my finals.
I see.
Yeah.
You had to take them afterwards?
No, luckily, my scores were good enough that even if I failed the final or didn't take it, I'd still pass the courses.
Oh, interesting.
So
That's
one teacher made me take like a little quiz over the phone. She felt the content was really important, and I did that. That was fine.
Okay.
Yeah.
So when you found out, even on the original scan, when you found out your plans might be changing, how did that make you feel?
I mean, we were shocked. My husband was there with me too. Our house was under construction still.
Oh, wow.
Nothing was ready.
Were you living in it during construction?
We were living in my parents' 2-bedroom apartment
Okay.
with our dog, our big dog.
Oh, your parents weren't in there.
No.
Okay.
They had a 2-bedroom apartment, so we were staying with them. So nothing was ready. I really wanted the natural birth, but I didn't question. When they were both so concerned, I was like, well, if that's what I need to do for my baby, couldn't do it that day. So it was scheduled for a few days later, that following Monday or Tuesday.
Which would have been 37 weeks?
Yeah. It would have been 37 weeks.
Okay.
Yeah.
Just term, early term.
Early term. What happened, though, so that was a Friday that the C-section was presented to me. That Sunday night, my water broke.
Oh.
So my daughter must have, I don't know, she
Wow.
heard something was going on. I don't know. She got
like,
stirred
I
up.
got to get out
I'll
of
pick
here.
my due
Get
date.
out of
Thank
here.
you very much. Was it an obvious water break?
Yes.
There was no question that's
no
my
question.
water.
Yeah.
Did that make you nervous, knowing that they didn't want you to go into labor?
That was exactly why I was so nervous. So
Were you at home or where were you?
I was at home. We had a get-together that day. My brother-in-law took pictures of my husband and I. It was the only belly bump pictures that I got because I'm not really into photos.
Uh-huh.
And everyone left, and then a few hours later, I went to the bathroom. I went pee, and then it just kept coming out.
Wow.
And I was like, wait, what is this? Is this my water break? What is this? And it just was literally a lot. And I told my husband, I think my water's breaking. And I was trembling with fear because all I heard was that doctor, we don't want you going into labor. We don't want that cord to come out and get compressed. And I'm just thinking brain damage. My baby's going to get brain damage.
Mm. So what do you do?
Scary.
We, my husband got trash bags to put on the car seat and towels. I put on some sweatpants with a towel. We didn't even have a hospital bag packed. We just threw a few things together, called my folks to come pick up our dog, and called my OB. He got to the hospital before we did. And so that was 11 p.m. My water broke, and my daughter was out before 1 a.m.
Oh, wow.
Oh, that's
really
fast.
fast.
Fast, super fast.
You were able to call right through to your OB at 11 p.m. at night?
Yeah.
And did your OB sound nervous?
He said, okay, we'll just no, he kept a very steady voice.
That's nice.
Yeah. But that didn't erase
Your fear.
my fear. But he was like, okay, well, let's just head over to the hospital. I'll meet you there.
Well, at least it doesn't magnify your fear.
Right. I've been with him since I was 12 years old.
Oh.
He's been my OB.
That's a long relationship with a doctor. So in a very quick time, you got to the hospital and the baby was out. What was the experience like?
I was just so nervous. And I remember saying to myself in my head, okay, just deep breathe, calm down. Like I could feel the adrenaline in my heart rate racing. And even my OB said, you've got to breathe. And but they met me with a wheelchair. All those things that are just very stimulating and a little bit scary. The epidural was a little bit scary. I had to crunch in a ball on my side, and I felt like my belly was in the way. I couldn't crunch enough.
Were you having any contractions?
No, I never had a contraction.
Okay, so you had to crunch forward, but it's not like you had to crunch forward around these
No,
surges
it was just she kept saying,
body.
I need you to bring your knees up more. I need you to bring your knee. And I'm like, there's no room
There's
for
a
me to
baby
bring
here.
my knees up. Yeah. And I remember that was scary, thinking about something going into my spine, like a needle, and what if it slipped. But the anesthesiologist, she did a great job. And
Do you know if it was a spinal block or an epidural or a combination of the two, or do you know the difference between them?
I know the difference, and I cannot remember what I got.
Okay.
I know that it definitely numbed everything below the waist, and it was hard for me to breathe. So it got probably around my diaphragm area too, because I remember expressing I felt anxious, like I wasn't able to catch a breath. She said, that's just the medicine.
Numbing you.
Yeah.
What was, the experience of the actual, because some people are really terrified of just the needle going in. Did they numb that? What did it feel like to just get the epidural?
They did numb it first. They numbed the area first.
So a little pinch of like lidocaine probably?
Yeah. It wasn't too bad. It wasn't too bad. I think I had other things on my mind, but
I bet.
Yeah. No, that pinch, that wasn't too bad. And then I could feel, without pain, I could feel them inserting like more of a little tube. But
So just the sensation, but not the pain.
Yeah.
Did your husband get to stay with you, or
He
did they
did.
make everyone leave?
He did.
That's
he
helpful.
stayed.
He was your
nice.
Bradley coach.
He was.
not the exact role that he planned to take on.
No, very different.
But Kristen, you had an epidural as well.
Yes.
Was it did you have concerns about an epidural just from the placement aspect?
Yeah, I think all the research that I did, that's the main reason I didn't really want it, just because I was so scared that, like, what if and because I was having such bad contractions at the time that I got my epidural, I couldn't stand still. So I was really scared that I was going to move and I wasn't going to have the strength to stay where I was supposed to.
And the needle would hit something.
Yeah,
that it's not
and they
supposed to
didn't
hit.
allow my person to stay.
Oh,
So
really? Not even one?
My husband couldn't stay, and he was really upset about it. Yeah.
Yeah, that's upsetting.
Especially like for his job, he sees like a lot of gory things. So he's like, I'm not going to faint. Like, can I? And I was having such bad back labor that I was like, I don't know how I'm gonna do this.
Usually they let one person stay.
Yeah, they
I feel
didn't.
like you should be able to demand that.
I do too. I don't know if it was the hospital's policy. That's why I think I've asked other questions, about that to see if it was. But it seems like it's a hospital thing, so it was probably
It
the
could
hospital.
be. I know what they're worried about is
Right.
that they'll all of a sudden have two patients.
Exactly.
If he sees you in pain, he might jump in and. Or the other thing is everything's very sterile, and like what if he just touches something, because he's not familiar with the sterile environment, then something becomes non-sterile. I have actually seen that happen, so that might
So
be a
it's just me.
concern. Yeah. But what did it feel like for you when the needle went in?
Again, they numbed it, so I didn't really feel any pain. It was just like a pressure. You knew something was happening, and I think I was much more scared of not knowing how it would feel. But the actual insertion and everything of itself, I didn't feel any pain.
Yeah, and the reason I asked both of you is because some of our patients say they want to not have an epidural just because they're afraid of the feeling, the sensation of that big of a needle pushing through that deep into your body, including my wife, by the way. That's why we had our first baby unmedicated, except for all the Advil I was taking, but that's a separate issue. And actually, most people who get it, even when they're really afraid of it, say, actually, that was no big deal.
Yeah, I think the fear before is much greater than the actual feeling.
What happens?
And for me, I fear something going wrong a lot more than actual pain. And just like you were saying, what if it slipped and hit like a nerve? And yeah.
What was the cesarean like? How present were you?
I was really present. that's where my husband actually, he did a great job. He didn't get to do the Bradley techniques so much, but and he's not a very verbal person. He doesn't like to talk much in everyday life. But during the C-section, I said, I want you, please tell me what you're seeing. Please tell me what they're doing, because they had a curtain. I even requested for no curtain, because I'm okay with the body. I think I would have been okay seeing or having a clear.
Yeah, some of them do a clear drape now.
This was not an option. But so, yeah, my husband was by my head, and he was telling me, okay, they're going in now, da, da, da. And then he told me when he could see her. And
were you aware of the things that were happening step by step as they were happening?
Yeah, I asked my doctor that too. I'm like, what layer are you cutting right now?
Wow.
I'm just interested, and I just felt like I had to know.
So when he's telling you what he's cutting, do you feel anything, or
No.
you're just totally numb?
Totally numb.
No pain, no pressure.
Nothing.
Nothing. That's kind of amazing that we can do that.
Yeah.
Sometimes I've seen the clear drape now, but I've also seen where they just hold a mirror for people who want to see what's happening.
Oh, yeah, I would have liked that.
Yeah. So you didn't feel it. Did you feel when the baby was coming through you?
No.
Any pressure, pulling, nothing?
Maybe a little tugging. There was a momentary scare because I had previously asked my OB, can you make my scar really small and really low? And so he kept saying, okay, your scar's really small. I think this is the smallest scar I've ever made. And wow, it's the lowest scar I've ever made. But because of that, maybe not just because of that, but when it was time to grab her out, he couldn't really get a good hand on her.
Oh.
And she kind of turned, and the cord ended up getting slightly compressed anyway. And then so he used a kiwi vacuum to actually extract her via C-section.
Interesting.
Yeah.
Did you feel that?
No,
Still no.
I don't have memory of feeling much. Maybe like you're saying, a little tugging sensation.
Yeah, that's what I would expect.
But yeah, not much else.
Did you hear her cry? Did she cry right away?
Here comes the most challenging part of this memory is, I had a friend who had a C-section. They did skin to skin right away. She went from out of the abdomen right onto her chest.
Yeah.
And I had requested that, and that's what I was expecting, and I didn't get that. I could hear my baby crying. I couldn't see her because the drape was up.
Oh.
So it felt like forever. It was probably more like 20 minutes, but it felt like an hour. I heard her crying, and she was in the corner. They were examining her. My husband was watching. I was like, Steve, tell me, like, is she okay? Tell me about her. Tell me this. And so he was talking to me, telling me, but I didn't get to see her for, it felt like a really long time.
How come they weren't able to do the skin to skin for you?
I think that there was, I don't even know exactly, but I think there was, because they had to use the vacuum, because there was a momentary cord compression, the way she spun when he was trying to retrieve her, that they automatically just took her over. And I requested twice, I'm like, please lower the drape so I can see my baby. And there was a nurse standing at my head, but no response. Please lower. I want to see my baby. Please lower the drape. And just no response.
It's frustrating.
That's hard.
I think the hospital where you were has a protocol about that. And so when you're asking them to do is break protocol, and they really don't want to do that because it puts themselves on the line.
But they could respond.
They could respond and they could tell you something, but I understand. And I think you're also different than most people. I think a lot of people look down and see that they're open and that, sometimes the whole uterus is out, and they will panic and freak out, and that creates more problem.
And I'm sure that's what created the protocol.
For both of you.
Yeah.
That's probably what created the protocol, but it's kind of a global policy, not an individual approach.
So were you all done then with the C-section when you got to do skin to skin with the baby, or were you still getting
so they were sewing me up while she was being examined.
Okay.
So it wasn't till after I was all sewn up that I finally got her on me.
What was that moment like?
I mean, it was a great moment. It was great. It was wonderful. She was fine. I was a little scared when they weren't bringing her and they weren't really, what's wrong? Is there something wrong? But she was okay.
Did you have a NICU team in the room from the get-go, or did they bring them afterwards because of that compression moment, or you don't know? I
don't know. Mm-hmm. I don't even think there was. I think it was nursing doing it. I'm not sure. I don't remember. There was my OB, my husband, the anesthesiologist was in there the whole time. And I think just maybe one other nurse, I think. I can't remember. I couldn't see anything.
Right, you couldn't see, so how would you know?
Yeah.
How was recovery?
Very interesting. So the good thing about the hospital I was they kind of have everything that you need. My daughter had a really funky shaped head. Not like a cone head that comes out vaginally, but like an elongated oblong head where the occiput, the back of the head, was really long. And part of her forehead, one side was down, the other was up. And even my OB, he said, I've never seen a head like that. So there was like some concern. So they sent in like a cranial specialist to look at her while I was in recovery. A lot of people came to check out her head to make sure she was okay. Turns out she was. She grew her head once her brain was, her head's totally round today. Yeah. And then for my own recovery, I stayed 4 nights. And it was rough for me. Having to have like a catheter in for the first, seemed like a day or maybe more, having to have the IV and pull the IV around, wearing those leg compression things they do now to prevent deep vein thrombosis. So being in bed with these things on your legs, these compression things, and they don't want you to do much. I was really wanting to get up and go for a little walk, and they're like, "We don't want you walking yet," and I felt stir crazy, and it was painful. I used all the pain medication, like they gave me Norco. I needed it. I was really
around your incision is where you felt the pain? Yeah.
Yeah, the incision and deep, like whatever other layer, all the other layers they cut
underneath,
through. Lots of burning. So anytime I would push myself up from laying down to come to sit, it would just burn. That's the best way I can describe it, as burning.
You were in the hospital for 4 days?
4 nights.
4 nights.
So it could have been 3, but the 4th one was, I don't know, somehow included anyway.
Oh.
And
buy 3, get 1 free?
Something like that, yeah. And so my OB was like, I would stay if I were you. And also just you get, more lactation support. It's just another day of getting the support.
Sure, and more nursing care for you and the baby. And,
yeah.
And you can't really lift at that point.
It was hard. She was so I was able to hold her. She was little 6-pound baby. That was okay. It was more me moving my own body.
Yeah. And how was the transition home? How long did it take until you started to feel like you again?
Weeks. And then I still get burning sensation even like almost 18 months later.
Around the scar, the incision area?
Not even the external incision, but there's this part deep inside on my right side that still burns from time to time.
Did you do any body work around those layers?
I did. Postnatal pelvic physical therapy, where they showed me how to massage the scar. And but now that you say that, it was mostly they were working on the external scar,
not the tissue.
But I didn't get so much on the deeper layers. No.
Got it. Well, here we are a year and a half later. And you're pregnant again, very pregnant.
Yes.
We are going to take a little break, and then when we come back, we'll talk about this pregnancy and your upcoming birth. So stay tuned. We'll be back in a moment. If you're worried about pesticides, endocrine disruptors, and other toxic chemicals, you're probably shopping in the organics aisle. Certified organic personal care products give consumers extra assurance that what they are getting is exactly what's on the label. There's really no other certifiable way to know if your deodorant contains worrisome chemicals hiding behind a term like botanical fragrance, or if an ingredient is a bundle of other chemicals listed as a proprietary formula. When a product is certified organic, it means that someone is checking the statements they make. A company can't be organic just because they say so. They have to go through an all-day, everyday commitment, yearly fees, and extra scrutiny by the third-party organic certifiers to get an organic designation. Earth Mama Organics is one company that has been certifying its products for over 10 years. There's a real nurse and herbalist behind the formulations and a real commitment to making safe, effective, organic personal care for pregnant women and the babies they're carrying. From safe organic deodorant to lanolin-free nipple butter to comforting postpartum down-there care to effective and gentle baby wash and lotion, Earth Mama is there with something made with love and organic ingredients. To find a retailer near you, go to earthmamaorganics.com and use the store finder. That's earthmamaorganics.com. Welcome back to the Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin. Today's co-host is Kristen Palasi, and we're talking to Heather before her imminent birth about her options for delivery with baby number 2. So, Heather, your first birth was an unexpected cesarean.
Yes.
You had wanted to do all natural, unmedicated. You and your husband did Bradley together, but it was determined that vaginal birth wouldn't be a safe option, and so you scheduled a C-section, and your baby jumped the gun and came out a little early by cesarean. Once you have a C-section, you have two choices with subsequent pregnancy. You can either plan for a repeat cesarean, or you can plan for a vaginal birth after cesarean. And some people plan for labor knowing that they're going to have a cesarean anyway because they want the benefits of labor. Where are you in the mix?
VBAC all the way. I really wanted to experience the vaginal birth.
Never a question for you?
Well, there's a moment when my OB, puts the fear statistics in there. There is some questioning. I did go back and forth, but my heart really wanted the VBAC. I wanted that experience. I wanted the benefits for the baby to come out vaginally.
What did your OB present in terms of pros and cons of each choice?
He said, yeah, we can do a VBAC, and then he would say my job is also to educate you about the risks. And this risk of, they use the word uterine rupture. And if that happens, I remember he said, if that happens, it's very bad. You have, minimal time to get baby out, and mom could lose her uterus. Mm-hmm.
So uterine rupture, meaning the scar, not on your belly, but the scar that's in the uterus from the previous cesarean, which heals. What if it doesn't heal as well as normal uterine tissue? And so during the intensity of labor, if that scar separates and opens, if it pops open, that becomes a potentially dangerous situation. Did he talk about the frequency?
He did. He said that the risk is very low of it happening because I was kind of at the minimal interval between pregnancies. They like it to be longer. I got pregnant with this pregnancy. My daughter was 9 months, so 9 months after the C-section. They like it to be a little longer interval than that.
Like a year?
Like a year, 18 months. I think I want to make sure
happy.
I want to make sure I'm saying that correctly, but longer.
So everyone has their own comfort zone.
Mm-hmm, mm-hmm.
Did he also talk about the risks of repeat cesarean?
Not as much focus on risks of repeat cesarean. The one thing he mentioned was if I wanted to have more children. So if I wanted a third pregnancy, that's when he said, there's a little risk with the third pregnancy. But no, not so much attention on risks of a second one.
Well, I just find that interesting because neither option is obviously 100% safe.
Yeah.
And if our job is to educate you, I feel like we should educate you about the risks and benefits of both choices. And I don't think there's a right or wrong choice. It's whatever choice you make that it's our job to support once you have the information about those risks and benefits on both sides. So is that what you plan to do? Did you make plans for a VBAC?
Yep. Yes. And my OB, the same OB, he was going to be my doctor. And one thing that stood out, he told me, because I ask a lot of questions. I want to be educated. one thing he told me, he was recently on a panel for a uterine rupture that went bad for a VBAC, where the doctor didn't make moves quickly enough. So the baby ended up being born with cerebral palsy. They're thinking from oxygen deprivation. So my OB was on a panel investigating what prohibited the doctor from acting faster, because they're supposed to be educated to do that, but sometimes things happen. So
over the years, I've had 2 patients that I know of that had the uterine rupture. And even the term uterine rupture is a little misnomer, because there could be a big moment of rupture, but I think more often is what happens is the scar slowly thins out, and then becomes so thin that the baby can move through it. And both of them are okay. I mean, physically they're both okay. Their uteruses are okay. Their babies are okay, because quick action was taken.
Yeah.
So, and we do a lot of VBACs. So, and the stated risk of that scar separating is about 0.5%, which is 1 in 200. So for some people, 0.5% sounds low. For other people, it sounds high. When you turn it around and say 1 in 200, sometimes it sounds higher to people or lower. And that's the funny thing about risk. You know, everybody perceives it differently, and it's ultimately your call.
That's exactly what my OB, he talked about, risk tolerance. And in those moments, it just, no risk to the baby sounded good to me. But I also had this feeling that, like, I had to try it. I had to try, because the chances of anything happening were so low that I think I would regret not trying it and being successful. So that also led me to kind of look at the midwifery route. I really wanted, I was interested in home birth. I was interested in birthing center birth, something outside of a hospital. And but was still seeing my OB as well in addition. And
so you started to do co-care?
Yeah.
With your OB and a midwife?
Yes, except my OB didn't know. I was just ready to tell him. I wanted to tell him, and felt so, because he's pretty conservative.
Yeah.
I kind of already suspected what he would say about it.
Were you planning for home or for a birthing center?
So at first, we were thinking about home, and the only reason decided not to was because my daughter being so young, I felt like it might be traumatic for her. She's seen me with the stomach flu, and she cried so hard, you know. So I kind of thought, you know, we don't really have family to take care of her outside of our home. Or her home that's where she's going to be when I give birth. I see. So the midwife owns a birthing center. I'm trying to put 2 things together, because for your first birth, you were not planning an out-of-hospital birth. No. I thought those people were nuts.
Yeah, we are. Yeah. But for your first birth, you were not planning an out-of-hospital birth. And then you were just talking about how the risk of VBAC is uterine rupture and how seconds count.
Yeah.
Right, and how your doctor was talking about how acting quickly is what makes the uterine rupture turn out okay.
Yes.
But then you decided to have the baby not at the hospital. I don't understand that.
You know, I just don't like the hospital. I don't like protocol. It's kind of why I left teaching. Protocol that's meant to, you know, protect against litigation, or that one case it might happen. I get nervous. And I was thinking it'd be so beautiful to have this birth in a place that looks like a spa, or like has low lighting. And I actually found a midwife who had been a labor and delivery nurse for many years. She's still a practicing RN. And I just felt like, I think this is going to be okay. I did go back and forth, where I was like, those moments getting to the hospital are going to count.
How far is the birth center from the hospital?
Oh, you know, LA traffic. It's not far. It's probably, you know, no more than 3 miles, but it could take longer to drive.
Right.
Probably 20-minute drive.
Or by ambulance, it would be quick.
Yeah.
If you needed to. And that's cool. I know the midwife you're talking about, and she's very sort of clinically minded as well. So she always has her finger on the pulse. She's, I think, a little conservative as far as midwives go. And whenever you get to a situation that's like, not sure what this is, she's aware of it and takes action rather than waiting to see what that might turn into.
Yeah.
So in terms of early intervention, I think that was a good match.
And she also has a lot of VBAC births under her belt, and has, I I think one needed to be transferred, but not because of rupture, because of the labor. The mom just couldn't take it anymore.
Yeah, which happens a lot, not a lot, but it's transport from out of hospital birth to hospital birth usually is not because of some emergency. It's because either labor is not progressing or mom wants, she's exhausted or needs some help with the pain, medicated help with the pain. So you're all set then. Oh, sorry, I cut you off.
No, that's okay. I was just wondering how your coach then felt about all of these. Was he right there with you?
My husband coach?
Yes. Your husband coach doula.
My husband coach, he does not like change. It made him nervous, but as he mulls things over, he also likes when I just make the decision for us. So he was supportive of whatever we did. I'm sure he still felt nervous about it. But we didn't end up going that route.
You say that in past tense because you're no longer planning to have an out-of-hospital birth.
Right.
Okay. What changed?
So I got through this VBAC issue, like worrying about the really low risk of the rupture happening, and I was all in for the birthing center with the midwife. But I was still seeing my OB as well for ultrasounds. And when I was like 35 and a half weeks, just shy of 36 weeks, I was curious, what position is my baby in, and has my baby turned, and is everything looking good? And the ultrasound showed that he is in the frank breech position with his bum down and legs up. And so I wasn't expecting that.
Right.
And that's when I got the news from my OB that the only two options were to schedule a C-section, like a week,
39 weeks,
a week before my due date,
which is now,
which would be now, or wait to go into labor, like you were talking about, and then have the C-section while in labor.
So the only two options are cesarean or cesarean.
Cesarean or cesarean.
Schedule it and hopefully get to it before you go into labor, or let you labor for a bit and then do a cesarean.
Yes.
How did you feel? Was your coach with you at that point, husband coach?
He was, yeah.
What was that moment like for you? Because, again, it's a big shift at the end of the pregnancy that you weren't expecting.
He put his hand on my shoulder and kept squeezing my shoulder because I think he knew I was super disappointed.
Oh. That was only 3 weeks ago.
Yeah. It seems like a lot longer ago.
I know.
I've been through so much since then.
Yeah, and that's what we're going to get to now is what happens next.
Yeah.
I mean, I can almost feel your letdown in that moment that, again, a big sort of bomb was dropped on your plan.
I mean, and I didn't think there was any other option. I was like, oh my gosh, I have to do C-section. So my next option was, okay, can I get this baby to turn somehow? And I even feel bad saying that and even talking about my baby here, that somehow he's in a wrong position. I mean, it just doesn't feel good to talk like that. But most professionals, most medical people talk about like that this position is bad or wrong.
Well, it's not ideal compared to a head-down position, right? Because head-down babies are easier to get out and avoid potential complications that really only happen with breech babies. So that's the one hand. On the other hand, breech babies are like 4 or 5% of all babies are breech. So that's a big enough number that it's just a variation. In the United States, that means one breech baby is born about every 4 minutes. So I wouldn't say it's a wrong position, but if you could choose, if any practitioner can choose, or most moms can choose, do I want the head down baby or the breech baby, we would choose the head down baby for you because it creates less space for complication.
Absolutely. And I agree. And I would choose that. I don't want to,
you don't want to feel like your baby's doing something wrong.
Yeah. Kids already, they learn shame pretty quick. So
yeah,
I kind of, I've talked to my baby to encourage that there's space in there, that he has options to move.
We talk about breech as a variation of normal.
Yeah, I like that better. Variation sounds good.
Yeah, and then I was breech, and
so was I.
Oh, you were? You were born breech?
I was born, via cesarean section.
Oh, I was born vaginally breech.
Oh, see, and we're both here.
Yeah, I'm still doing weird stuff. I mean, it's fine. I'm okay with it. Yeah, so what did you do to try to give the baby space to move or encourage the baby to move?
So I went right home and Googled. My OB was like, none of this stuff works. He's like, here, it's just there's no research supporting that any of these methods to turn the baby work. Mm-hmm. Oh, he also said there's something called external cephalic version, but because I had had a prior cesarean section, he was not willing to do that, the ECV. He didn't want to risk rupturing that scar, interfering with that scar and having something catastrophic happen, which he also said the chances were really low, but he wasn't willing to take it.
Okay. So he just gave you those two options and said nothing you can do to turn the baby, and
he said, you still have some time. Sometimes they turn. It's unlikely, but sometimes they will. Sometimes they turn in labor. So I went home and I talked to people and I looked online, and wow, are there a lot of things that people do to try to turn their breech babies.
Yeah, there are. I
did a lot. I found you that way.
Yeah.
Which has benefited. My ligaments are nice and loose.
Oh, great.
I tried moxa with the mugwort. My husband would burn it at my toes while I was inverted on we have an inversion table out in the garage.
Oh, that's convenient.
Acupuncture. I did some acupuncture. I did some meditation, imagining the baby moving, and the Spinning Babies website, the different poses.
Mm-hmm. Yeah, so we have a whole episode of our podcast called BREECH 101. It's 3 parts, and there are 2 doctors and 2 midwives who are our guests, and we talk about all these things in greater detail. So if anybody's listening and wants more information about what is moxa, what is acupuncture, what does chiropractic do, you can listen to that podcast. But you did a lot.
I did a lot, and it was not fun. I think if I could have done just one thing at a time, or if I didn't feel like I was under the gun to get it done, I think that it wouldn't have been so bad. But I really was feeling like I'm doing all these things. I'm spending a lot of money, too, on these attempts that, I didn't know if they were really going to work or not.
Yeah, they're money-consuming. They're time-consuming. You already have a toddler at home.
Yeah.
It's a lot to juggle, and it's so much pressure. It's like, if I can get this baby to turn, I can go back to my plan. And if not, I have to grossly divert from the plan I had and what I wanted.
Yes.
Well, those things didn't work, quote unquote.
He's still head up.
He's still head up. Mm-hmm. And frank breech means his head is up, his butt's down, and his legs are kind of up near his face.
Yeah. My initial worry was, is he going to have hip dysplasia? And my daughter ended up having torticollis, which has now been resolved, but that was a lot of work and stress to kind of treat and make sure the exercises were done. And so I was like, there's, slightly higher chance of breech babies having this hip dysplasia. And I'm thinking, I don't want to go through that again. Mm-hmm. But that's not even on my mind anymore.
Yeah, where are you now? Because now you're only 2.5, 3 weeks later.
Yeah.
And you're 39 weeks, and as you're walking into the studio, you're having contractions. So things are going down soon.
Things are happening soon. Yeah, I just really, my gut did not want the C-section again. The recovery for me was hard. Some people they don't know, maybe they don't notice, or they think it was great to have the C-section. I feel like there's a chance maybe it's what made my breastfeeding experience a little bit more challenging. I wanted the vaginal birth experience, and that burning sensation, I thought, gosh, a second one, am I going to have this, even more of this kind of residual weird sensation or pain? And holding my toddler, picking her up, she's about 25 pounds.
If you have another cesarean.
If I have another cesarean, will I be able to, still pick her up? Because she wants to be held by mom. But
do you have an option besides the wait for a cesarean or schedule a cesarean?
So according to my OB, no. He even asked one of his partners, who, funny enough, is the doctor who delivered me back in 78. And And this doctor also looking just the fact that I would be a VBAC and it would be my first vaginal birth, they just both didn't think I would be an ideal candidate. They didn't want to take...
Because that doctor who delivered you still occasionally delivers breech babies vaginally.
And my OB does as well. And the cases where he said he does them is in twins. First one comes out head down, second one's breech.
Which is much more common because let's talk about the risk. What's the risk? Forget about the VBAC for a moment. What's the risk of delivering a breech baby vaginally?
Are you asking me?
Sure.
Oh, I don't even like saying it out loud. It's a very low, very, very small % chance of, I guess they call it head entrapment.
Yeah.
So, bum and legs come out, and then at the neck, cervix doesn't open up enough to let the head out, and that your baby can die.
Your baby gets stuck, head inside you, which could be dangerous, but also... And the doctors who do vaginal breech delivery look for several categories of safety, several criteria to try to minimize or prevent that from happening. For example, babies that are measuring very large, they don't do if the baby's head is stuck in extension, leaning back. They're more likely to get stuck on your pubic bone, and they won't do that. And also it makes a difference if the doctor has training on what to do in those situations or doesn't have any experience with it. So your doctors who they do, well, so with the twins where baby A, the first baby to come through is head down and the second baby's breech, as long as they're close in weight, if the first baby comes out and there's no complications at all head down, then the door's kind of open. The second baby will either turn and come out head down or will come out breech, or they can literally just reach in and pull the baby out. That's why they're comfortable with that. And there are doctors who don't do breech delivery who make an exception for after-coming twins, where the second baby is the one that's breech. But your doctors sort of do, and the other doctor who delivered you does breech, even if it's a singleton, sometimes, not
only if,
frequently.
So the twins was the one time that they do it. The other is if the mom has had a previous vaginal birth. And so I remember he said, then we know what your pelvis can do.
You have a proven pelvis, they call it.
Proven pelvis. Yeah, okay.
Your pelvis is
right now my pelvis is not proven.
No, your pelvis
a lot of pressure.
Mine is not proven.
Has to prove itself.
Yeah.
But they also do VBACs. So they do occasional breech and they do occasional VBACs, but together they felt like it's not something they're comfortable doing in your non-proven pelvic state.
Exactly. Yeah, that sums it up. The other thing that on that ultrasound that we did, the head measurement versus the torso measurement, there's a ratio they use. And if the head is much in a higher percentage category than the torso's in a lower one, he was saying that's not an ideal breech birth. Just that fear of the butt and the trunk not opening the cervix enough and the head getting caught.
So what option does that leave you?
C-section if I was going to go with my OB. Who I love. I would not trash talk my OB, but that was my option.
I mean, it's a fair assessment. They have a comfort zone.
Yeah.
And they're letting you know you're outside of their comfort zone.
And he even said when we asked him more questions, he said it's just the medical legal climate. He used that word, that phrase. The medical legal climate is not where we are comfortable doing.
Well, we talk about
birth.
We talk about this occasionally on the podcast. Where there's different kinds of risk. Risk to you and your baby is medical risk, and risk to your practitioner is liability. And he's letting you know, I think honestly in his assessment, what he's concerned about the risks for you and your baby, but also honestly letting you know that were he to deliver this baby, if anything goes off course, then his liability is very high because this is out of the norm.
Yes.
Did you find another practitioner?
Well, I did. You helped me find a few.
There are doctors here who do more regular breech delivery, and they also do a lot of VBACs. And I didn't know. You shared your surgical report, and I didn't know how they would feel about doing a breech that's also a VBAC. But actually, a few of them were open to it.
Yeah.
And you picked one.
I picked one who he has no doubt about me, he says.
And what does that mean?
when I ask him all these questions, well, my baby's head is, in a higher percentage bracket than his torso, and I'm a VBAC also, and to this doctor, the two don't even connect. They don't concern him at all.
They're two separate
sets
things. Of risk factor that don't compound each other. It sounds like is what he's saying.
Right.
You know the risk of VBAC, and the benefits, and you know the risk of vaginal breech birth and the benefits compared to cesarean for each of them. Mm-hmm. You have both on the table, mm-hmm. but they don't compound each other.
Yes.
Well, and it seems like also then that's like a comfort zone. But right, because we're talking about different people's comfort zones. So for him, in his comfort level, those things don't make him have anything to worry about. Or he feels confident in that.
Yeah.
In addition to being an obstetrician, in his real life, he's also a high-risk OB. He's a maternal fetal medicine specialist. So he sees the more delicate cases of pregnancy on a daily basis.
And that's another reason I wanted to stay with him. I believe that he'll also be able to recognize signs of something going wrong early, in case we do need to transition to C-section.
So your plan now is to go into labor, mm-hmm. go to one of the hospitals where he delivers, mm-hmm. labor there, and deliver your breech baby vaginally. And it's got to have been a hard decision. I know it's a hard decision. I've been emailing with you and texting you and talking to you. And I think a lot of times when people have hard decisions to make, they ask me, what would I do? Because mm-hmm. nobody can decide this for you.
Yeah, I think I asked you that too.
And the problem is, in your case, I don't have a great answer for what I would do. I would be really in a tough spot.
Yeah.
I mean, if my wife was asking me, it's her call, right? If my wife was asking me, what should I do? It would be really tough. All I could do is sort of weigh through the pros and cons on both sides over and over again. And for someone who wants vaginal birth as passionately as you do, for you and for your baby, I can't say. There's no clear winner in my mind.
And that there's still, even with my decision, it's not 100% clear. There's still that, oh my gosh, what if, that I'm trying to just breathe through right now. It's been a really hard decision. When I talked to my OB, and he said, listen, if you were a gambling person, you'd win every time doing a breech vaginal delivery. Mm-hmm. He's like, but I can't put you or your baby or myself at that very slight risk that you would lose. He goes, but I don't think you will. So it's interesting because he actually has been somewhat supportive of me doing what my heart is looking to do with the vaginal breech birth.
And it's not like you're going in blind. You
right.
have extensively studied the risks and the benefits of both modes of delivery for you and for your baby, both. And you made a choice. And I mean, it's an impossible choice to make. And it sounds like you're still, like you're in it, but your mind is still not 100% settled.
I'm not settled. My goal is to be settled during the birth so that I don't tighten up. I don't want to have fear during my birth.
Who's coming?
Who's coming to the birth?
Yeah.
That was another last minute decision. Well, my husband will definitely.
Your husband, Coach Doula.
Yeah. Yes. And then the midwife I was previously working with offered her services as a doula. You say doula?
Monitrice.
Monitrice. Yeah. Which I thought I wasn't really interested in. And then I thought, my husband's, he hasn't been the best at practicing all these different breathing techniques. Like for him, it's a real drag to go through these every night. And so I was thinking it might be beneficial to have her there. She's seen a lot of breech births. She's delivered a few breech babies as well. I think I'd feel more comfortable having her and the doctor both there.
Your doctor's very calming.
He's so
calming.
I
know him. He's very calming.
He's amazing.
And my other question is, your doula coach husband, this is an impossible decision for you. How has it been for him?
Really hard, too. he also back and forth. He doesn't like veering from things he knows. So the fact that we had to change hospitals, which is a whole other thing, he didn't like that. The fact that we're changing doctors so late in the game, he didn't like that either.
It can be really unsettling.
Yeah. He likes to know.
You were with this doctor, you said, since you were 12.
Yeah.
Who you were with and who delivered your first.
Yeah.
So it's a big change.
It's a big change.
A doctor that you've been with since you were 12 to a doctor who you've been with for 12 days.
But I really did fall in love with this doctor because of his mannerisms, his advocacy for women and babies. I love my OB, but his bedside manner isn't. He's not an emotional person. He can do some eye rolling sometimes at these hippie ways of wanting a all natural birth. He can sometimes. I remember he said for my first one when he asked if I wanted an epidural. This was way before any talk of C-section. I said no, I want to go natural. He goes, okay, if you want to be in pain.
Oh.
So he's a little curt
perhaps
sometimes.
That's why you switched to a midwife.
I think there was some of that there, and yeah.
I'm curious about how it felt for you then to find this doctor that you're now going with, even though it was late in the game. How did it feel to find somebody who gave you that sense of? I feel like you've just heard a lot of negative things. How did it feel to find somebody who you said believed in you? How did that? Even though you feel unsure, how does that help you feel does that make you feel safe? I mean, how does that make you feel?
That's what sealed the deal. Because I was ready to, even look for, there's another doctor who does breech births but insists on epidural and you have to be on your back when pushing. But he has a really high success rate. He's done hundreds of breech births. He's at, one of the best hospitals. And I was really thinking maybe I should do that. Maybe that's what I should do. But the doctor that I ended up choosing, it was his mannerism and his confidence. It's like having someone say that they have no doubt about you and that they're excited to deliver your breech baby. It was like, oh, that's who I got to go with. Someone who's going to be calm in the moment. If there's an emergency, I believe he'll be able to handle it.
I have a final question, which is, with everything that you've experienced in your first pregnancy and birth, and now this pregnancy, there's always a chance that this birth will end up, no emergency, but will end up for one reason or another turning into a cesarean birth. Mm-hmm. Are you prepared for that as well?
Yeah. I am prepared for that. I want my baby to be safe and healthy. I want to be safe and healthy. And if something needs to happen to make that happen, I wouldn't regret it. There might be moments like, oh, I just wish I could have had that, But even with my daughter, I don't really sit around thinking about the fact that she was born cesarean. In fact, I never think like that. So I am prepared for the chance that might happen.
Well,
and grateful that it's available.
Yeah, absolutely. It's whatever's going to happen. It's going to happen really soon.
Yeah.
You're already past your, last time you had your baby 2 weeks ago or so.
Yeah, she was born 36 weeks, 5 days, and tomorrow I will be 39 weeks with this pregnancy.
Yeah, and it sounded like when I was on the phone with you earlier, like things might be warming up.
I really feel, because I didn't get to feel all these later, toward the end sensations with my first baby.
What are you feeling?
Lots of pressure, lots of tightening. They talk about the baby dropping. I feel like he's sitting right there ready.
It sounds like the orchestra warming up before
yeah.
the baby. All right. Did you have any other questions, Kristen?
No. Thanks for
any
sharing
other
all your
thoughts,
stories.
Heather?
No, I appreciate you having me, and hopefully my story can help somebody. Just know that there's other options.
It's not been too. I help a lot of people through BREECH. help a lot of people through VBACs, and once in a while, a BREECH VBAC. It just doesn't even come up that often. And but that's just in my practice, and our audience that listens to the podcast is much bigger. So I know that people are going to relate to you in the position that you're in now and down the road. I'm so grateful for coming in and sharing what's been an emotionally difficult journey. And I'm also grateful that you'll come back afterwards and let us know how it went.
I definitely will.
Thank you.
Look forward to it.
Thanks at home for listening to the Informed Pregnancy Podcast. If you enjoy our program, please like us and leave a comment on iTunes or in your favorite podcast app, and take a second to share us with your friends. Visit us online for access to our blog, documentaries, our series on YouTube, The Real Midwives of Los Angeles, and other pregnancy and parenting resources at informedpregnancy.com.